Welcome to the second Ryan White Planning Council public hearing for 2023. This public hearing was pre-recorded online through Zoom. If you would like a copy of the information being presented this evening, you can view and download the documents from our website at rwpc, capital HOUSTON.org. My name is Rodney Mills, and I am one of the co-chairs of the Affected Community Committee of the Ryan White Planning Council. Also with us this evening is the chair of the Ryan White Planning Council, Crystal Renee Starr. The co-chair of the Priorities and Allocations Committee, Bobby Cruz and Diane Beck, council coordinator in the Planning Council's Office of Support. The focus of tonight's public hearing is the recommended priority rankings and funding allocations for fiscal year 2024, which will begin on March 1st, 2024. But first, there will be a presentation on Project LEAP by Diane Beck, who is one of the facilitators of the program. Afterwards, Bobby, the co-chair of the Priority and Allocations Committee, will give an overview of the committee's process, followed by the recommendations for the fiscal year 2024 priority rankings and funding allocations for services funded by Ryan White, Part A, Minority AIDS Initiative, which is also referred to as MAI, Part B, and state service grants. The allocation recommendations include level, increase, and decrease funding scenarios for each grant. Remember that everything discussed this evening will not affect how services are delivered now, but will impact how services will be delivered in year 2024 and 2025. After the presentations, I will provide instructions on how you can make public comment regarding the information presented today. At this time, I would like to turn the meeting over to the chair of the Planning Council, who will describe the role of the Planning Council and the purpose of this public hearing.
Thank you, Rodney, for that informative introduction. Good evening, everyone. I am Crystal Renee Starr, chair of the Houston Ryan White Planning Council. I am pleased to welcome you to our public hearing. I will briefly describe the history of the Planning Council, what it is we do, and why we are here tonight. The Ryan White program is the largest federally funded focus exclusively on providing HIV care for people who do not have significant healthcare coverage or financial resources for meeting the challenges of living with HIV. Ryan White fills the gap in this care that are not covered by other sources. The Ryan White HIV/AIDS Treatment Act of 2009 was first enacted in 1990 as the Ryan White Care Act and has been amended and reauthorized 4 times in 1996, 2000, 2006, and 2009, adjusting and with each reauthorization to accommodate new and emerging needs, such as an increased emphasis on providing life-saving and life-extending medical services for people living with HIV. The Ryan White program works with governmental entities and community-based organizations to provide HIV-related services to more than 500,000 people each year. There are several parts within the Ryan White program, each one designed to meet the needs of different communities and populations affected by HIV. Part A funds are designed to serve metropolitan areas and are awarded to the Chief Executive Officer, primarily responsible for providing health care in the geographic area. In the Houston eligible metropolitan area, the person is Judge Lena Hidalgo. In 2002, Harris County received over $26 million to provide services for people living with HIV in the 6 county areas, which includes Harris, Fort Bend, Waller, Liberty, Chambers, and Montgomery counties. In 2007, the state asked the Houston Ryan White Planning Council to make recommendations for Part A and state services funded funds Part B funds are awarded directly to the state of Texas and are used to provide care for people living with HIV in a 10-county area, which includes the 6 counties named previously, plus Austin, Colorado, Walker, Waller, Warden counties. In fiscal year 2022, Ryan White Part A, Part B, and state service dollars total over $31 million. Again, Congress required that most of these funds be used to provide medical services to people living with HIV in the 10-county area. Currently, approximately half of the 30,000 people living with HIV in our area are using a Ryan White funded service. By law, the council is responsible for determining the number of individuals who are in our area who are living with HIV, assessing the needs of the HIV community, establishing a comprehensive service plan, setting service priorities and allocating funds, and ensuring that there are significant services to meet the future needs of the changing epidemic, assuring that appropriate services are available to meet the needs of the underserved and unserved, women, infants, children, and youth, ensuring access to services for those who have substance abuse treatment needs, and assessing the administrative mechanism which procures services and distributes funds. The Planning Council falls under the Texas Opens Meeting Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community and take public comment and input very seriously. The council is currently holding meetings in a hybrid format, which gives you the option of attending in person or virtually. The council meets on the second Thursday of each month at noon. For more information, call the Houston Ryan White Office of Support at 832-927-7926 or visit the website at rwpchouston.org. This information will be repeated for you again at the end of the program. It is to remember that Ryan White funds are the funds of last resort. This means that all other resources for an individual must be exhausted or unavailable before Ryan White funds can be used. For example, a person must use their private insurance, Medicaid, or Medicare benefits before they're eligible to have Ryan White monies paid for their primary medical care. There is also several income eligibility requirements that governs the use of the Ryan White funds. Many of the services that we provide have an income cap of 300% of the current federal poverty guidelines, which means an individual with a yearly income of $43,740 or less would be eligible for assistance provided all other avenues of coverage have been exhausted. The same guidelines applies to a single parent with one child, would be $59,160 or less. The service rankings and allocations would be reviewed this evening, including services provided by the Ryan White Part A, Minority Aid Initiative, referred to as MAI, Part B, and Texas Department of State Health Services. Examples of some of these services which Ryan White program funds are allowed to provide include outpatient primary medical care, medications, oral health, mental health services, and assistance to pay for health insurance premiums, co-pays, and deductibles. The purpose of this public hearing is to inform the community about the recommended service priorities and funding allocations for fiscal year 2024 in order to get feedback from consumers of Ryan White funded services and others as to how the recommended changes reflect their ability to receive medical care and supportive services. Community input is not only necessary, it is vital to all of the Planning Council processes and it is encouraged at every level. At this time, I would like to introduce our next speaker, Diane Beck, Council Coordinator in the Office of Support. She will present information on the Planning Council's training program, Project Leap. Diane.
Thank you, Crystal. Hello. I want to talk with you about an educational opportunity for people who want to learn about the HIV prevention and care system in the greater Houston area. The name of the program is Project LEAP. LEAP stands for Learning, Empowerment, Advocacy, and Participation. Project LEAP is for people living with or affected by HIV. Classes start at the end of July and the program is free. But the expectation is that students participate in one class a week for 17 weeks, and they come to class prepared to listen and engage with the presenters and with one another. Project LEAP is unique to Houston and is only offered to 30 students once per year. The goal of the program is to provide skills so that graduates use these skills to become active and effective participants in the local HIV planning groups, such as the Ryan White Planning Council or the Houston HIV Prevention Community Planning Group. Graduates help shape the future of HIV services in our community. Project LEAP was created because local planning groups need people living with HIV and others who are not afraid to speak up and advocate for the needs of consumers. After graduation, students feel more knowledgeable and confident as they work with doctors, social workers, consumers, and others to design services. If you are a person living with HIV, or you have a friend or family member that is challenged by HIV, you are a perfect candidate for the class. So how does Project LEAP work? Classes are held on Wednesdays for 17 weeks. 15 students participate in the morning class, and 15 different students participate in the evening class. Each is about 4 hours and includes hands-on activities, group projects, and field trips. Guest speakers are experts in their field and enjoy sharing new and updated information with the students. What will you learn? As you can see from the long list on the screen, some of the topics covered in class include HIV 101, the history of HIV in the Houston area, tools for designing and funding services, leadership training, and much more. Class participants learn valuable skills, including meeting facilitation and how to use Robert's Rules of Order. If you don't know what that is, we will teach you. You will also learn presentation skills, how to read and understand data, planning and evaluation skills, advocacy, and cultural competency. The facilitators provide information and handouts for each class. We have mock meetings with role playing. We bring in expert speakers, and there are hands-on activities, class projects, and again, several field trips to see what planning groups do when they meet. Those eligible to apply for Project LEAP are people who are living with HIV or those who are affected by HIV either personally or professionally, and who can meet the class expectations in terms of attendance and participation. So what do you get out of Project LEAP? You get knowledge and skills that will help you advocate for your health as well as the health of others. You get an extensive binder of information with easy to read materials about HIV. You get access to experts and mentors, as well as some new friends who share your passion and concern for the issue. Most of all, you get the opportunity to make a difference for people living with HIV.
So, how do you apply to be a Project LEAP student? You must submit a written application before July 7th. We will call and set up an interview, which can be in person or virtual, depending upon your comfort level. The classes will be hybrid, so students can choose if they wish to participate in person or virtually. Classes will begin in early August and end with graduation just after Thanksgiving. To find out more information or to apply, go to our website, rwpchouston.org, or call 832-927-7926, or email me, diane.beck@harriscountytx.org. www.rwiplanning.gov, and I will get back to you. You can also check our Facebook page, RWPC Houston. This contact information will be repeated for you at the end of the public hearing. We would love to hear from you. At this time, please turn your attention to the co-chair of the Priority and Allocations Committee, Bobby Cruz, who will explain the committee's process and their service category funding recommendations for 2024.
Thank you for the valuable information, Diane. Many current and former council members are graduates of Project LEAP and would agree that the training is very valuable for those who want to be involved in the planning process. Speaking of the planning process for HIV services, each year in April and May, the Quality Improvement Committee of the Ryan-White Planning Council considers many facts when reviewing the definition of each Ryan-White funded service category. When the Quality Improvement Committee changes what is offered through a service, the changes are based upon information such as the documented needs of various populations living with HIV in the greater Houston area. Also, the history of service usage, epidemiological trends, and the availability of alternative services, including both Ryan-White and non-Ryan-White funding. Once the service category definitions have been approved, it is time for the Priority and Allocations Committee to prioritize the individual service categories and allocate monies for each one. Tonight, we are going to talk about the work of the Priority and Allocations Committee. The mechanism for awarding Ryan-White funds changed in 2014, and we are now seeing southern parts of the country, such as the Houston eligible metropolitan area, receive higher grant awards, while areas like San Francisco and New York are experiencing significant decreases in their award amounts. That is because the South is where diagnoses are on the increase. Starting in 2015, the Houston area received an increase every year, except 2 where we got a small decrease. This is good news for the Houston area, but some would say that we have been underfunded for many years, and we now have the opportunity to catch up with the growing number of people who need our services. In addition to our Ryan-White grant, Houston also receives Minority AIDS Initiative, or MAI funds. The goal of the Minority AIDS Initiative is to address racial and ethnic disparities in HIV-related health outcomes and expand community-based capacity to serve people of color living with HIV. In recent years, a significant factor in determining the allocation of funds to individual service categories has been the availability of private health insurance offered through the Affordable Care Act. There are currently over 5,800 clients registered in the Ryan-White system that are enrolled in either public or private health insurance. The anticipated result is that there will be a reduction in the use of Ryan-White funded medical services and an increase in the number of clients needing help through the Ryan-White Health Insurance Assistance Program. Another significant factor is unpredictable application processing time and changes in the eligibility requirements of the Texas HIV Medication Program, commonly referred to as ADAP. As you know, access to medications is vitally important, and we are allowed to use local funds to fill this gap. This year, recommendations from the Quality of Life Work Group were also considered during the allocation process. Specifically, the needs of individuals over the age of 50 who are aging with HIV. Living with HIV as well as taking medications to treat HIV can prematurely age the body, resulting in an earlier need for services considered geriatric for the general population. The proposed service priority rankings and funding allocations to be presented tonight are for fiscal year 2024, which begins on March 1st, 2024, and includes the following funding streams: Ryan White Part A, MAI, Part B, and state services. The proposed service priority rankings for 2024 are based primarily on use and need as documented in the 2020 Houston HIV Care Services Needs Assessment. The fiscal year 2024 allocations are based primarily on fiscal year 2022 expenditures, final allocations for fiscal year 2023, and the anticipated number of clients utilizing Ryan White funded services, including those who enroll in private insurance, but need assistance paying premiums, copays, and deductibles. Currently, there are approximately 13,000 people living with HIV in the Houston area who rely on Ryan White funds to pay for some or all of their HIV-related medical care. Please note that the needs assessment report was completed prior to the COVID-19 pandemic and is scheduled to be updated later this year. I will now present the service priorities and the first of three different funding scenarios. The level funding scenario, which assumes we will receive the same amount of funding in 2024 as we did this year. Detailed information about all the funding scenarios is included in the information packet, which is available on our website. The first 9 service categories are defined by the federal government as core medical services, and the legislation requires that we spend at least 75% of our grant funds on direct medical care for Ryan White clients. The remaining 25% can be spent on support services, such as transportation to medical appointments, service linkage, and more. The Houston area typically spends 80% of our Ryan White funds on core medical services for Ryan White clients. The recommended allocations for 2024 are the same as the fiscal year 2023 final allocations, unless otherwise noted. Priority number 1, ambulatory outpatient medical care. The proposed allocation for Part A is $11,169,413 plus $2,068,055 in Minority AIDS Initiative funds, for a total allocation of $13,237,468. This is a decrease of $130,000 and $222 due to underspending in 2 subcategories. Priority number 2, medical case management. The proposed allocation for Part A is $2,183,040 plus $314,061 in Minority AIDS Initiative funds, for a total allocation of $2,497,101. This is an increase of $400,899 to accommodate the addition of 5 medical case managers targeting individuals over the age of 50. Priority number 3, local pharmacy assistance program. The proposed allocation for Part A is $2,067,104. Priority number 4, oral health. The proposed allocation for Part A is $166,404, and the proposed allocation for Part B is $2,332,193 for a total allocation of $2,498,597. Priority number 5, health insurance premium and cost sharing assistance program. The proposed allocation for Part A is $1,583,137. For Part B, it is $1,028,433. And for state services, it is $864,506 for a total allocation of $3,476,076. Priority number 6, mental health services. The proposed allocation for state services is $300,000. Priority number 7, medical and nutritional therapy. The proposed allocation for Part A is $341,395. Priority number 8, substance abuse treatment. The proposed allocation for Part A is $25,000. This is a decrease of $20,677 due to underspending and the availability of other funding for this service. Priority number 9, hospice services. The proposed allocation for state services is $259,832. The remaining service categories are defined by the federal government as non-core or supportive services. Priority number 10, emergency financial assistance. The proposed Part A allocation for the pharmacy assistance subcategory is $2,039,136, and the proposed Part A allocation for the other subcategory, which provides one-time short-term emergency food, telephone, and utilities, is $100,000. Priority number 11, referral for health care and support services. The proposed allocation for state services is $175,000 to be used to provide HIV education and discharge planning in the Harris County Jail. Priority number 12, non-medical case management. The proposed allocation for Part A is $1,267,002, and the proposed allocation for state services is $350,000 for a total allocation of $1,617,002. Priority number 13, transportation. The proposed allocation for Part A is $424,911. This includes bus passes, van service, and gas vouchers for those living in rural areas. Priority number 14, linguistic services. The proposed allocation for state services is $68,000. Priority number 15, outreach services, primary care, retention, in-care. The proposed allocation for Part A is $320,000. This is a decrease of $100,000 due to underspending. The fiscal year 2024 service dollar allocations total $29,446,622 under this level funding scenario. Because the exact amount of Ryan White funds we will receive in 2024 is not known yet, we also have a decreased funding scenario and an increased funding scenario, each of which is designed to best meet the needs of the community under these different circumstances. These funding scenarios are also included in the information packet on our website. If the Minority AIDS Initiative were to get a decrease in funding next year, all primary care subcategories would be decreased by the same percentage. This applies to the total amount of MAI service dollars available. If the Minority AIDS Initiative were to get an increase in funding next year, all primary care subcategories would be increased by the same percentage. This applies to the total amount of MAI service dollars available. If Part A were to get a decrease in funding next year, all service categories except subcategories 2B, geriatric medical case management, 2I, medical case management for veterans, 2J, medical case management for youth, 10, outpatient substance abuse treatment, 13A, service linkage for youth, and 13B, service linkage for newly diagnosed and not in care, would be decreased by the same percentage. This applies to the total amount of Part A service dollars available. If Part A were to get an increase in funding next year, allocate the first $500,000 to ambulatory outpatient primary medical care proportionately across all subcategories except 1H Vision Care, and 1J Pay per Performance Pilot Project, and allocate the next $200,000 to the Health Insurance Assistance Program. Any remaining increase in funds will be allocated by the Ryan-White Planning Council. Now, if Part B and state services were to get a decrease in funding next year, a decrease in funds of any amount will be allocated by the Ryan-White Planning Council after the notice of grant award is received. Now, if Part B and state services were to get an increase in funding next year, we would allocate the first $200,000 to oral health untargeted, divided evenly between the general oral health and prosthodontics subcategories. Then allocate the next $200,000 to the Health Insurance Assistance Program. Any remaining increase in funds will be allocated by the Ryan-White Planning Council after the notice of grant award is received. Many volunteer hours were devoted to this challenging work. We generously thank all of the community members who worked so hard to fine-tune each service category, prioritize the services, and allocate the funds. Public input is strongly encouraged and is an integral part of this process. Depending on the comments made regarding the information presented at this hearing, the Priority and Allocations Committee may meet on Wednesday, June 28th, to discuss whether the comments provide enough data to justify changing the recommended priorities or allocations. I will now turn the floor back over to Rodney, who will explain the process for submitting public comment regarding the information presented at tonight's public hearing.
Thank you, Bobby, and have a very special thanks to the Priority Allocations Committee for their hard work this year. After the hearing information presented this evening, you may want to give public comment to the Planning Council. The Planning Council falls under the Texas Open Meetings Act, and its processes are open to all of the public at all levels. We strongly encourage participation of all members of the community to take public comment and input very seriously. There are several options for you to provide public comment to the Planning Council, and you are not required to give your name or your HIV status to do so. You can email your comments to feedback@harriscountykTexas.gov. You can fax your comments to 713-572-3740, or you can phone in your comments to 832-927-7926. Or you can send your comments through our Facebook page, RWPC Houston. Comments received by our office before noon on Tuesday, June 27th, to be forwarded to the Priorities and Allocations Committee for review and consideration. If significant public comments related to the service priorities or allocations are received, the Priorities and Allocations will meet via Zoom at noon on Wednesday, June 28th, to review comments and consider revising their recommendations. On July 6th and July 13th, the Steering Committee and the Planning Council will review and vote on the fiscal year 2024 service priorities and funding allocation. You are welcome to attend any of these meetings, either virtually or in person. Please check our website calendar for meeting packets, location, and Zoom information. This concludes the final Ryan-White Planning Council public hearing for 2023. I would like to thank everyone who viewed the program for participating in this important process. As stated earlier, the funding recommendations presented tonight were not affect how services are delivered now, but will impact how services are delivered in the year 2024. The Ryan White Planning Council meets on the second Thursday of every month at noon in a hybrid format, which gives you the option of attending in person or virtually. Please check the calendar on our website, rwpchouSton.org, for the location of meetings and the Zoom link. The staff is working remotely and in the process of relocating the Office of Support. So please call rather than come to the office if you need additional information. Time is running out to apply for Project LEAP 2023. The following training program looks at the HIV prevention and care system in Greater Houston area. Please visit our website to download an application or submit your application online. Applications are due by July 7th. This is a wonderful learning experience, and I encourage everyone interested in HIV services to apply. If you would like to send comments to the council, request additional information, or learn about our education classes, such as Project LEAP, you may do so by calling the Office of Support at 832-927-7926, by faxing to 713-572-3740, or you can send an email through our website, rwpchouSton.org. On behalf of the Ryan White Planning Council, we thank you again for participating and have a great evening.